Hello and welcome to Dental Studies Simplified. I am Dr. Ankita Kotecha and today's topic is Periochip. Periochip is a commercially available local drug delivery agent. The first point is composition, that is Chlorhexidine Gluconate 2.5 mg. Remember, Chlorhexidine Gluconate 2.5 mg. The entire chip weight is 6.9 mg, which contains Chlorhexidine Gluconate 2.5 mg in a hydrolyzed gelatin matrix cross-linked with glutaraldehyde and also contains glycerin and water. So this is the total composition of a Periochip. Talking about the commercial availability, manufactured by Dexcel Pharma Technologies, Israel, this chip is available as a small round-edged rectangular chip, that is round edge from one end for insertion into the probing depth of greater than 5 mm, orange-brown colored chip. It is individually packed in separate compartments of aluminium blister packs and they are stored at room temperature of 20 to 25 degrees Celsius. So this is the commercial availability of chips. Coming to the dosage and administration, dose as we all know 2.5 mg, but the frequency of placement is once every 3 months. That is, once the chip is placed, the patient is recalled for re-evaluation at 3 months interval, and at that interval visit, if the probing depth persistent is still greater than 5 mm, second chip placement has to be considered. So this is the frequency of the Periochip placement. Now how to place the chip? This chip, as we discussed, is a rectangular and round end from one side, the dimensions of which are 5 by 4 by 0.3 mm thickness. Now, for placing this chip into the probing depth that is greater than 5 mm, first thing is isolation of the tooth with the pocket associated. So, drying that area and isolating it, followed by holding this chip with a forceps and placing it inside the probing depth such that this round edge is into the depth. It reaches the tip of the depth. Okay. Now, after placing this chip into the pocket depth, if further positioning is required, then it is done with the help of the tip of the forceps or any flat instruments. Remember, the whole idea behind rounding this edge and using flat instrument is to avoid any soft tissue injury either during the placement or even for the duration that this chip is present inside the pocket. Avoid soft tissue irritation or injury. And after this chip is placed inside the pocket, it is followed by a parodontal pack placement so as to avoid any kind of disturbances or trauma to the chip. So this is all about dosage and administration. Coming to the precautions, the first thing is avoid any oral hygiene measures there for the first few days. That is, no brushing for say at least 3 days, after which the brushing can be resumed as normal. But avoid flossing for the 10 days, that is till the pack is present in the oral cavity, because flossing leads to the dislodgement of the chip. Next, the dietary habits. Patient must be advised to be careful and cautious while eating from the treated side. Then, patient must be counseled about the post-operative pain and discomfort or sensitivity beforehand. But if it is severe, patient must be advised to contact the dentist immediately and take necessary treatment. And the last and the most important precaution is in an unlikely event of displacement of the chip. Highly unlikely, but yes, if it still happens, patient is supposed to contact the dentist and take the necessary treatment immediately. It depends on the day of displacement. Like, if the displacement of chip happens within 48 hours, a new chip placement has to be done. But if the chip placement occurs after 48 hours, then the dentist is not supposed to place any new chip. Rather, he must evaluate the patient at 3 months interval. And if the chip displacement occurs after 7 days, then the patient has to undergo the entire therapy once again. That is scaling and root planing plus a new chip placement. So this is the treatment taken for chip displacement. And this completes precaution. Coming to the mechanism of action, the chlorhexidine is released in a biphasic manner. That is, an initial burst release of approximately 40% due to its diffusion property from the chip, followed by release in a linear fashion for the next 7 to 10 days due to the enzymatic degradation of the chip. Remember, the chip is biodegradable, so as the chip gets degraded, chlorhexidine gets released. This happens for the next 7 to 10 days and that is why the pad placement is to be for 7 to 10 days and flossing is avoided for 7 to 10 days. So this is the mechanism of action. Coming to the indications, the only indication is as an adjunct to the scaling and root planing in pocket depths greater than 5 mm to achieve reduction in the pocket depth. Remember again, this is not a newer therapy which will substitute or replace the standard periodontal therapy. It is an adjunct to the routine therapy, that is scaling and root planing followed by the chip placement. And the contraindication is hypersensitivity. If a person is hypersensitive to the chlorhexidine, then this chip placement must be avoided. And the last part is adverse reaction. The only and the most common adverse reaction associated with this chip therapy is toothache. It may be pain or most commonly post-operative sensitivity. Remember, we have done scaling and root planing followed by chip placement. So both the things will contribute to the discomfort which may manifest as pain. That is, the scaling and root planing leads to sensitivity and the chip placement might cause a little bit of irritation initially, because it is usually observed that in the subsequent intervals when a chip is placed again, this reaction is not reported. That means it is the initial placement irritation which causes that pain and manifests as toothache. So this is the most common adverse reaction. This completes the topic Periochip. I hope this topic is clear to you all. If you still have any doubts or any queries, please ask them in the comment section below or mail me at dentalstudiessimplified@gmail.com. Thank you for watching and listening to me. Study well. Have a good day. Stay safe.